Hello, I'm Dr. John Ward, Director of the Coalition for Global Hepatitis Elimination at the Task Force for Global Health. The achievement of global goals for hepatitis B and hepatitis C elimination, twice endorsed by the World Health Assembly, will avert over 7 million deaths by 2030. To achieve these goals, model countries are demonstrating how non-liver specialists can deliver hepatitis vaccination, testing, and treatment services in resource-constrained settings. Indeed, to achieve global hepatitis elimination, WHO recommends the delivery of hepatitis prevention and care services throughout health systems, including in the work of mid-level providers. Unfortunately, for many, their health systems do not yet provide these services. For example, of African newborns, only 1 in 5 receive hepatitis B vaccine. For the over 300 million persons living with hepatitis B or hepatitis C, 80% remain to be diagnosed. For me, this brings to mind the shared goal of hepatitis elimination in the pursuit of universal health care coverage, health equity. As health systems put in place the services needed to prevent, detect, and treat hepatitis B and cure hepatitis C, that health system becomes more capable of responding to other endemic and epidemic threats. In turn, the achievement of UHC makes possible the elimination of hepatitis in the process of building stronger health systems broadly. Recognizing this dual benefit, the Coalition for Global Hepatitis Elimination calls on the World Health Assembly and the UN General Assembly to recognize hepatitis elimination as a key step on the path toward the achievement of universal health care coverage. Thank you.